Hey, aloha everyone. My name is Jessica Lau, and I'm your orientation leader for today's session, Health and Wellness. We have 3 individual sessions within this one: KOKUA, the Counseling and Student Development Center, and the University Health Services. Before we get started, I'll be covering some housekeeping items for today's webinar. First, you should be able to hear me clearly. If you cannot, please note in the chat box so we can troubleshoot with you. Simple fixes include connecting your audio on the Zoom window, turning up your computer volume, or using external headphones. Second, please utilize the Q&A function if you have questions for the presenters or about what was shared. For most sessions, all questions will be saved for the end of the presentation. Additionally, participants in the chat are asked to be respectful of others and stay focused on the topic of this webinar, so those questions can be easily seen. Finally, after the session, we'll be uploading the recordings of this webinar to the Visit Days platform in the videos section. All recordings will have closed captioning. Now, I would like to introduce and welcome today's presenters, Dr. Rachel Kinahan, one of the counselors at the KOKUA Program, Dr. Alexander Kaduma, a staff psychologist at the Counseling and Student Development Center, and Dr. Kristen Shawley, the Chair of Health Promotion for the University. With that, I'll turn the presentation over to Dr. Rachel Kinahan.
Thank you, Jessica. Okay, welcome. Good morning. I'm Dr. Rachel Kinahan. I am with the KOKUA Program, which is the UH Mānoa Office for Students with Disabilities. Now, the KOKUA Program is the office designated to work with faculty and students to ensure institutional compliance with university policy, as well as federal and state laws, which prohibit discrimination on the basis of disabilities. So our program actually serves the wide range of students at UH Mānoa, undergrad, graduate, professional students with a range of learning, physical, psychiatric, and other documented disabilities. And we're really looking at facilitating equal access for students with disabilities to the entire Mānoa experience. So KOKUA has been around for 55 years, and we're currently serving over 1,400 students who have self-identified as students with disabilities. So there is no, in the general application process, disability status is not requested or even considered in determining admission. So that means that students are getting in under all the same technical standards and academic standards for the university. And to go further into that, there really is no special education at the college level. So the Individuals with Disabilities Education Act is K-12 entitlement law. And that Disabilities Education Act is really about free and appropriate public education and looking at success. However, under ADA, we're looking at equal access. So accommodations are not required to produce an identical result or level of achievement, but we're really looking at equal opportunity to obtain the same result, gain the same benefit, or reach the same level of achievement. So if you're coming from high school and you previously had an IEP or a 504 plan, that does not simply carry over to college. So colleges cannot inquire about disability, and students are not required to self-identify. However, if a student is pursuing accommodations, they need to self-identify to the disability office. It's the student's responsibility to request disability-related services each semester. And so we really want students to be self-advocates for their learning. The accommodations that are appropriate cannot fundamentally alter any course program or requirements. So from the point of admission through graduation, we all work together to share the responsibility to ensure that all of our services, activities, and programs are equally accessible. So KOKUA's primary focus is really the academics. So we look at academic accommodations. However, we also help in other areas such as housing accommodations, parking, graduation, student employment, and other co-curricular activities. And we additionally provide technical support to the entire UH Mānoa campus when we're looking at accessibility stuff. So eligibility for our services. UH Mānoa students with permanent documented disabilities who voluntarily disclose their disability status to KOKUA are eligible for services. So when we're looking at what a disability is, we use the ADA definition, which looks at a person who has a physical or mental impairment that substantially limits one or more major life activity, or a person who has a history or record of such an impairment, or who is perceived by others as having such an impairment. So KOKUA works with a wide range of disabilities, and these would be health-related, mobility-related, visual disabilities, hearing-related, learning disabilities, and an other category, which looks at, students who are on the spectrum, students with more communication-based disabilities. Within health-related disabilities, we have health conditions, but that also has psychiatric conditions as well. So we have a large population of students who have been diagnosed with anxiety, depression, bipolar disorder. For visual disabilities, we have, students that have low vision or students who are blind. Hearing related disabilities, we're working with students that are deaf or hard of hearing. And another large population that we work with are students that have learning disabilities. So students that come in with ADD, ADHD, dyslexia, or dysgraphia. And we have been seeing a trend of more students coming in on the spectrum. So all students are expected to abide by the University Student Conduct Code, including those students who work with our program and students who have disabilities. So some common services and accommodations would be early priority registration, letters to faculty, which would verify disability status. We don't share diagnosis. We're not sharing any confidential information. We're mainly sharing like a type of category. Housing accommodations, exam accommodations, which could be time extension, distraction reduced space to take the exams, whether it's use of assistive technology. Note-taking, which we do in two ways: peer note-taking, where we're having another student take notes, or we use a program called Sonocent or Glean, which is an audio note-taking software. Alternate format production, which would be a conversion of printed text. So students could use it with different type of assistive technology, like our Kurzweil, which is a text-to-speech software that we use. Communication access, which would include sign language interpreting, real-time captioning, petitions and academic adjustments, foreign language substitution, withdrawals, leave of absences. And we also work with students for doing different types of check-ins or calendaring, and really just help the student navigate if they're having any disability-related concerns that are impacting their academics. So fall 2021, this is our transition semester. So we're coming out of this pandemic where we've all been working remotely and having online courses, and we're really looking at kind of this semester as being a transition. So 62% of our classes are still completely online, 19% are going to be in person, and then we have a hybrid, both in person or online. And we're really looking at navigating towards more of a primarily in-person semester by spring 2022. So as a new student, when should you reach out and how should you prepare? So we really encourage reaching out to our program early, and early meaning, in April, just so if you are eligible for certain accommodations like early and priority registration or needing housing accommodations, that's really the best time so that we can actually help you to get those accommodations if eligible. For housing accommodations, I'll go over that a little bit, but of when the deadline was. But, you know, a great way to prepare for our intake appointment is really just to, you know, review past disability evaluations or services if you've previously had an IEP or a 504. You know, parents are also included if they want it to come to the intake with their student, if the student is feeling like they might need a better explanation. But we're really looking at what barriers that you've encountered in the past, or what you might anticipate on the basis of your disability. So connecting with our office is optional, but it is highly recommended. So we have a lot of students that say, you know, I wish I came sooner. I didn't know I could get this. I wasn't sure if I wanted to. We have some students who really wanted to, you know, try to start college without disability services. But we do, you know, tailor to a student's comfort level. It's better to set things up and have that already set up in case you need it, instead of trying to set it up later. So we always encourage early reach out. So if you are interested in looking at eligibility for the program, we're currently doing most of our pre-screens through email. So send us an email. You can also call us. Our office is open, but students will be asked to fill out a brief Google form, which provides student information. We'll set up a 1-hour virtual intake appointment with one of our counselors. And then you can send your documentation in prior to the intake appointment, or we can also talk about what that looks like and what documentation we'll need at the appointment. So this intake appointment really looks at this interactive process. You know, we're trying to understand the connection between students' disability and their related service needs. We're really gonna try to find what barriers you're facing or what barriers you're anticipating facing. And that can always be adjusted as needed. So if things come up, we can always adjust. KOKUA will then determine what services are considered appropriate. And these accommodations are free, confidential, and they won't show up on a student's transcript or be viewable by others in STAR. So we really maintain confidentiality as much as possible. It is also important that in addition to that first intake appointment, that students are continuing to follow up with their KOKUA counselor to set up accommodations each semester. So for housing accommodations, we do help with housing accommodations. However, the deadline was May 1st for priority deadline. We still do review late requests, but there are no guarantees for housing accommodations after the deadline. So, you know, the process can take about a month for a review. And if you are interested in having housing accommodations, we can definitely look at what accommodations you might be eligible for in future semesters. Okay, so this is our contact information. We are still open virtually, but our office has just reopened. So Monday through Friday, 8 to 4 p.m. We're located in QLC Student Services on the ground floor. We have 2 phone numbers, and our main email is kokua@hawaii.edu. And please follow us on our Instagram with any updates. But that's our contact information. If you have additional questions, please reach out to us. Thank you.
Hi, everyone. My name is Dr. Alexander Kaduma. I'm one of the staff psychologists at the Counseling and Student Development Center at UH Mānoa. I'm going to share a little bit about our office and its function at the university, and also some of the services that are available to you as a student here. Like Dr. Rachel Kinahan, and the KOKUA Program office, our office is also located in the QLC Student Services building. We're on the 3rd floor. I'll talk a little more about how we've transitioned most of our mental health services to a virtual format. So we are trying to decrease foot traffic to our office as we are beginning this transition semester for our office as well. But you are still able to access us and contact us, and our counselors are here on campus and can connect with you very quickly if you need to get a hold of us. The whole purpose of our office at the university is to serve the mental health care needs of students at UH Mānoa. We are staffed by licensed mental health care professionals. We also have a peer fellows program, which is a team of undergraduate and graduate students who work alongside our mental health care staff, and they can provide other kinds of support for students like personal coaching, keeping up with assignments, ways to kind of connect with other campus resources if you're new to this university or this campus. And then we also have a team of counselors who work alongside our student housing staff to provide after-hours mental health intervention services for residents that live in our campus residence halls. Some of the common reasons that students may seek out support from our office can really include things like a normal adjustment to college concerns, stress from school feeling overwhelming, difficulty living either far away from home or balancing, other parts of your life with your schooling. We also help students with other kinds of issues related to their mental health, such as mood or emotional concerns, disordered eating behavior, substance or drug and alcohol use concerns. We help students who might be struggling with their learning or might have something with their mental health that's getting in their way of being able to perform in school the way they want to. And then we also see students for any sort of things that might happen in their life that impact their mental health, like losing someone they love or encountering conflicts with people they care about. And then we also importantly see students for any sort of mental health crisis situation, and that can include suicidality, wanting to harm oneself, wanting to harm other people, difficulty kind of controlling one's behavior, or being concerned about severe mood swings that are impacting other people. We also see students for any sort of crisis situation that involves the death of another student or any sort of tragic event that might impact our campus community. This transition semester during the fall, we are going to continue offering all of our normal services like before, but all of our services are going to be available virtually, so for the most part via Zoom. So we offer individual, couples, group, and career counseling. And again, those are where you can meet over Zoom with one of our mental health care professional staff. We also offer crisis availability for any sort of crisis situation that might come up. So during our business hours, students can always contact our office if they are experiencing a mental health related crisis. And we have on-call counselors available to speak with them during that call. In the past, we've had students be able to come to our office physically, and we are still set up to be able to accommodate students coming to our office if they don't have access to their own technology to access appointments, or have any sort of accommodation needed where they would need to come to our office physically and couldn't access their appointment via Zoom. We also are available for our faculty and staff and campus community for consultation around mental health related concerns. So if students are concerned about another student, or a faculty or staff member is concerned about a student's mental health and doesn't know how to talk with them about it or how to proceed, sometimes they call our office and want to consult with our counselors about what to do. Then we also offer a variety of educational services like self-help workshops geared toward mental health, wellness, and well-being. We also offer virtual drop-in support spaces, which are 1-hour sessions you can sign up for via Zoom. They're hosted by our peer fellows and counseling staff, and students can drop in to meet other students who might share similar experiences, like living on campus or being part of the LGBTQ plus community, or being a student athlete. All of our services can be accessed via our website. You can learn more about our counseling services there. And then if you want to sign up for any sort of our educational programs, like our workshops or drop-in support spaces, you can also sign up for them via our website. So if you're interested in connecting with our office and find yourself wanting to speak with a counselor, then the two primary kinds of initial contact we usually have with students is either a urgent crisis appointment, where a student contacts our office in an urgent need to speak with someone right now. And then that's where that call is then connected to an on-call counselor who can speak with that student immediately. For non-urgent needs, where a student might want to have some meetings with a counselor over time, but doesn't necessarily need to speak with them right that moment, then we still encourage students to contact our office, and you can schedule an initial telephone appointment with one of our counseling staff. At that initial telephone appointment, our counseling staff will help the student connect to whatever kinds of service is most appropriate for them, whether that's our counseling services here at the center or help with referrals to providers outside of the UH system. If a student needs to initiate meetings with one of our counseling staff, we can also then schedule you for an initial appointment with us, where you would be able to meet with a counselor via Zoom. We're also well connected to our other campus resource offices, such as our KOKUA program, our Learning Assistance Center, our Women's Center, our Title IX office. So we do a lot of work with students who might be connected to other university services or want to learn more about other university resources, and we can help direct them to those. I also want to share that as a university student at UH Mānoa, you will have access to an online training program that can help you learn more about how to take care of yourself and also how to help others with their mental health. We offer this program because we know that a lot of students don't necessarily reach out to a counselor first when they have a mental health concern. A lot of times people might reach out to their close friends or family members or people that they're close to. So we kind of want all of our campus community to feel comfortable talking about mental health concerns, and then also being able to direct each other to the right resource when needed. So this program that you'll have access to is called Cognito, and it's tailored specifically to the UH Mānoa campus community, and it will help you learn about ways to talk with friends and others that you're close to around mental health topics, and giving them good referrals to local resources if needed. And it really kind of looks like a video game. So you engage in an imaginary conversation with a friend. You can learn more about the program on our website, but to access it, you would just use the enrollment key Mānoa student. You would follow the on-screen instructions and click launch, and then you can complete the program at your own pace and even stop it and pick it back up at a later time. So if you want to get in contact with our office, the best way is to just call us. Our counseling staff is available during our business hours, 8:30 to 4:30, Monday through Friday. We're open during all of the university breaks. We're just closed on state holidays. And then you can also check out our website at manoa.hawaii.edu/counseling. And then you can see all of our available services and calendar of upcoming events there. Mahalo for your time, and thank you for being a part of our university community.
Hi, everybody. Okay. Hi, everybody. I'm Kristen Shawley from University Health Services. I'm the chair of health promotion for our university. And so I'm going to talk about a few different things today, including a little bit of information encouraging everybody to stay safe during COVID and give you some resources for kind of transitioning back to a very healthy semester. So I'm going to talk about two different programs and two different locations. The University Health Services Clinic is the what you would consider a kind of one-story medical clinic. It's been around for a long, long time. It's on East West Road next to the Kennedy Theater. And it is the place to go for your medical care. And then we also have health promotion, which is where I'm located, which is more your behavioral health education, prevention education services, and some short-term counseling services, which health promotion is actually in the QLC building right next door to Counseling and Student Development Center. So we're in two different locations, which is kind of nice. So health services medical clinic, we'll talk about them first. So basically, if you fall off your skateboard and you skin your arm and you need some immediate medical care, you would walk to the front door of the clinic on East West Road, and you would encounter a nurse that would be kind of out right by the front door, and there'll be somebody doing screening, and that's because of COVID right now. So we're open 8 to 4:30, but the door is closed due to COVID, and there'll be somebody who would help you right away. So even though we encourage people to do online appointments, and I'll show you how to do that in a second, we're always open. So it doesn't mean that if you don't have an appointment and you have an urgent need that you can't come right over. So injury, illness, we have a dermatologist who comes is on our staff and comes into the building a couple times a month. We have a fully functioning lab. We also have a psychiatrist that kind of goes back and forth between the Counseling and Student Development Center and University Health Services. She services at both locations. We do sports medicine. We have a lot of support that we provide for people who are physically active and then might get injured, out running, but we also support our athletics teams too. Telehealth, of course, because of COVID, has become a thing and a super powerful service. So right now we kind of do a hybrid. We encourage people to come in, especially for their first visit, if they're comfortable with that or they're able to come in. But we also use a fair amount of telemedicine currently at this time as well. Someone who has a mild rash and wants to get some help or support, but maybe doesn't want to drive in from the leeward side or the windward side. So we're doing a hybrid, and it kind of depends on what the individual's needs are, physical health needs are, and we're going to continue that this year for sure. Also, that sometimes comes in handy if we have individuals who are currently dealing with a COVID-19 infection. We don't necessarily want them coming into the clinic, but we monitor them on a daily basis. Also have a very extensive women's health clinic, which is an awesome, awesome service. And so for birth control, routine screenings, whole separate nurse practitioner and women's health clinic. She's awesome. We have a pharmacy. I encourage people to come over to the pharmacy, especially for the OTC stuff, which is like your over-the-counter ibuprofen or your sunscreen, because we just keep it at cost. We don't make any profit off of it. So it's cheaper perhaps than what you might find at a Long's or, at a Walgreens pharmacy, and it's on campus. So if you needed sunscreen right away, or you needed, some kind of, like I said, analgesic, like an ibuprofen, you can get that just as you're, walking across campus. And then the other thing that sometimes people ask, especially if you're from the continent or you're coming internationally, you might come with a certain prescription. And so sometimes people ask, oh, can I just refill my prescription from my doctor in California here at the clinic? And the answer to that is initially no, but you would be evaluated for whatever that prescription might be. And then it would be prescribed. It could be the current prescription prescribed by one of our doctors. Okay, so let me talk a little bit about COVID and give you just lots of help and support. Some of you may know that we did a survey over the summertime of faculty and staff, and we also did a survey of students. And the good news is that the vast majority of those who were surveyed, both faculty, staff, and students, have been vaccinated or had strong intention to get vaccinated. Huge amount of people. That's really, really good news. However, even since we did that survey, we know now that even those of us that are fully vaccinated still potentially with the new Delta variant could become infected and or could infect somebody else. Now, granted, we know that the symptoms for fully vaccinated people are usually mild or you're asymptomatic. There are no symptoms, but it kind of tells us we're not quite out of this. As faculty and staff, we really want to be out the gate and transitioning into, a COVID-free university, but we're not quite there yet. But we need everybody's help. I mean, that's bottom line. That is the key. So all of those protective things that we have been doing now for a year and a half have got to stay in place. Now if you're on campus, you're going to have your mask on indoors and outdoors. For a while, it could be, if we were outdoors, we could take it off. You really should have it on indoors and outdoors. That's the recommendation. It's a mandate indoors. But staying 6 feet away, still social, distancing, that 6 feet is still really good. Cleaning your area, if you're a student employee and you share a desk with someone else, you leave your shift, you should clean your shift. All of those kind of commonsensical things that really still with the new variant have got to be in place. The other thing I wanted to mention too is that within health services, since the start of the pandemic, we actually have a COVID response team. It's a 4-person team of individuals who are doing our contact tracing for people who either have been exposed to the virus or might be a close contact. And so that team is working, they are kind of 24/7 because we always have someone on duty. They are a great resource. So if you have questions, concerns, let's just say you're not vaccinated yet and you want to know where the closest place to get vaccinated is near you, they can help you with that kind of resource. For those individuals who, for perhaps religious exemptions or in some rare cases, medical exemptions, are not able to get vaccinated at this time, they will be coming to health services also, on a weekly basis, our residence hall folks in particular, to get weekly testing. So our team is there if you ever need help and support. Okay, so I mentioned booking appointments online, super important, because then you know exactly when you can get in, either via telemedicine or an in-person visit, and it's super easy. And as I mentioned earlier, if you had an urgent need, we aren't going to stop you and say, oh, I'm sorry, you don't have an appointment. But for non-urgent things, it's just for your own sense of scheduling, nice to know that you can get in whenever you have in between time in your schedule during the day. Okay, so the go-to for anything, question related, appointment related, update related, is the hawaii.edu/student health services. So all you really have to remember is just the /SHS, and then you can get into all these different other icons that could help you make an appointment. Okay, so there's kind of the front page of Health Services Mānoa's website. Looks a little different now. It's a little more interactive, but you can just scroll down and see how to make an appointment. Super easy. Easy. Okay. And we really encourage people, as I said, for either telemedicine or a live appointment to kind of set that up beforehand. Okay, so let's just say it's a Saturday night, and going back to that, let's say you got a bee sting. You're walking, somewhere with your friends and you get stung by a bee and it's swollen up a little bit and you're concerned. You're like, okay, well, how do you take care of bee stings? I don't remember. So you can call health services at any time. And if you call, like I said, on a Saturday night, we're not open because we're Monday through Friday, 8 to 4:30. You're still always going to get a nurse. You're going to get our after hours medical advice line. And what that individual can do, it's a live person. They will triage. You will describe kind of what's going on. I got stung by this bee. It's kind of swollen. It hurts right now. And they will walk you through your next steps in terms of medical care. If it's something relatively minor, they might suggest putting ice on it, elevating it, go sit down for a while, and then they will monitor you kind of the next hour. They'll probably give you a call back and see how it's going. If it's something a little more serious, they might be able to tell you where the nearest urgent care is and how to get there. Or if it was something that really needed attention right away, they'll tell you how to get to the nearest ER or even help you with, an emergency call that way. So we just tell people, call us at any time, day or night, because regardless of what it is, you'll either, be able to come in and see us right away, or you'll get in touch with a nurse right away. Okay, so here's another kind of plug in terms of, I gave you the plug about staying safe during COVID. Another plug, of course, is to make sure that you have health insurance. And the reason is so important is, even though a lot of our students are super healthy and we always want it that way, you have one, kind of more serious health issue, and without insurance, sometimes it can be very, very costly, and that could interrupt, your college success. So we don't want that for anyone. If you come into the clinic, health insurance most health insurances are accepted. Kaiser would be an example of not being able to accept that because they're their own HMO. So Kaiser subscribers have to usually go to a Kaiser facility. That being said, that I really encourage everyone to have insurance. We will never turn anybody away at the health services, plain and simple. Even someone who showed up without any kind of health insurance, we're still always going to treat them. That's a given. And then work with them later, in terms of billing and sliding scale and everything else. So that's, know that whatever health issue or concern you might be having in the moment, insurance or not, come see us. But of course, we know that doesn't always take place in all parts of the community or all parts, the state. So that's why we really encourage, no matter where you go, to think about getting the health insurance plans. HMSA has a student plan specifically for university system students. So if you need more information about how to get on that plan, it's very, very comprehensive. Pretty much you subscribe to that plan, and very low copay in some cases for certain services, no copay at all. And you can definitely use it at the clinic. So if you need more information, you could always ask me about that, or call our front desk, or, log in and get more info on the website. Okie dokie. So just a couple more minutes, and I want to go over to the prevention side of things, the health education, health promotion side of things, which, as I mentioned, is where I come from, and also is in the QLC building, student services, right next door to the counseling center. So we have a variety of programs to support students' overall health and well-being, and ultimately their college success. One of those programs is Basics. This is a short-term counseling and screening program for students around substance use issues. And that can involve alcohol. It can also involve other drugs. It could be weed, it could be tobacco, it could be nicotine dependence. And the program is really neat because it's short-term counseling and screening. It's usually 2 or 3 appointments. And many of our students do come to us as referrals, meaning there might be some alcohol infraction in the residence halls or something happens on campus, and judicial affairs will refer persons to us, but you can come in voluntarily. And the other thing that I think is so cool about this program is it truly is education, because in so many situations, individuals with like a high risk alcohol use, infraction, let's say in the residence halls, they may just not realize kind of what responsible drinking is. They may need the education around consequences related to alcohol or other substance use. And so they come to basics maybe a little nervous, and they leave very often feeling much more supported and feeling like they have good decision-making skills, which I think is awesome. In some rare cases, if individuals come to us and they need more substantial treatment services like alcohol treatment service, then we can refer for that. We're also doing tobacco cessation counseling in our office. Vape product use, we've been doing some research during COVID. People are under a lot of stress, people are home. We've seen an increased use in e-cigarette vape product use. So we're also doing cessation support around nicotine dependence or cessation from tobacco products. Malama Project is for students in recovery. This is a very important program that was implemented a few years back. It is for students who want to have a substance-free college experience and be supported and feel that that's a common ground. So there's weekly support meetings. We have a student lounge where students can come to have those weekly support meetings. As you might guess, during COVID, we had to do a lot of that via Zoom, but we will come back a little more in person this semester, hopefully. And then they had lots of activities and events too. Sometimes they, do a cleanup, like an INA kind of cleanup day, just so that there was support and camaraderie amongst this group of students in recovery, and of course, allies, and anybody is always welcome. And then last but not least, Manoa Alcohol Project. These are posters that you will see all throughout the residence halls. You see them upper campus, encouraging people to make healthy decisions around alcohol use, because as we know, high-risk alcohol use is probably one of the #1 health concerns on college campuses. So Manoa Alcohol Project is a fun-filled program that has lots of great, media and poster campaign stuff going on all year. Okay, and then just a couple other quick things. Student Health 101, I want to tell everybody about this. You have access to Student Health 101, or sometimes it looks like Campus Well / Student Health 101. This is an amazing monthly magazine it's so cool. I mean, it's really, really well done. We subscribe to it. We're one of a few hundred schools across the country that subscribe to it. We can, though, customize it, which we really like. So we can infuse Manoa-based information into our version and make it, specific to Manoa. But the articles are great. It's always very timely. And, even if you're, even for certain things like academic things, you're writing a paper on body image issues, you can probably go into Student Health 101 and look through the archives, and sure enough, you'll find a really good article or something, on stress management. Sure enough, there's tons of information on stress management. So you'll get messaging at the start of the school year about how to subscribe, but it really is pretty easy to just get the app on your phone and just, get it every month. Okay, and then here's kind of my last little slide. Because we haven't been around so much, especially last school year, I just want to remind everybody who's coming back that we are a tobacco-free system, and that includes all of our 10 campuses, and that includes any tobacco products, including vape products. So this is, is to protect everybody's health, and especially during COVID, we know there has been a connection, unfortunately, between smoking or vaping and increased risk for COVID-related health concerns or consequences. So as much as we can kind of encourage people to keep this off campus and keep themselves tobacco-free, we want to. Also, as I mentioned, we have support services for those who might want to quit in our offices. We can always help you with that. And then one last little thing, and then I know probably the group has questions. Some of you, going back to health services, some of you may be currently turning in your health clearance forms, especially if you are either freshmen this year, or you're maybe a sophomore and you were all online last year, so you didn't have to turn in health clearances. Now, let's say you're coming back onto campus and you're going to have, one biology lab. So once that happens, you need to turn in all your health clearance information. If you need any help or support with that, you can let me know, or you can contact health services. If you've already turned in your information, great. My one request is that you only turn it in like one way. So if you upload it in our portal, that's great. If you happen to fax it, that's okay too. Yeah, secure messaged it, file dropped it, that's okay. But don't do all three, because right now we've got hundreds and hundreds and hundreds of people sending all their clearance stuff in. And so if, and I understand if you're a student who wants to make sure we get it, if you send it in 3 times, that just means it needs to be evaluated 3 different times. So if you could just send it once and then watch your email, you will get an email a few days afterwards to let you know you're cleared. And then the last final thing I'm going to say, and then I'll be quiet, is just going back to COVID and getting vaccinated, which we want everyone to do to protect the entire campus community and all your friends and loved ones. If you get vaccinated and you have your vaccine card, there's 2 things you should do with it. One is you can right now upload it into LumaSite. And I'm sure most of you have been learning about LumaSite, because that's what we need to show in order to get onto campus, show that we're symptom free. It's a really good idea to upload your card into LumaSite, because eventually, as the semester progresses, you may need to be able to show you've been vaccinated to go to certain school activities. So that's one place to put it. It also is probably a good idea at some point to upload it into the health services portal. Then we have a copy of it in case you lose it. We have it for you. And also for people in the residence halls in particular, they're going to need to show that. They're going to need to upload it if you live in the residence halls, because then that gives you access and you're cleared, and you don't have to get tested in the residence halls. All right, thank you, everybody.
Thank you, Kristen, and thank you to our panelists. So I'll invite them all to join us again, and we'll do some questions from our Q&A box. So the first question is geared towards counseling services. So the question is, do counseling services cost anything?
That's a good question. No, our counseling services at the CSDC don't cost anything to students. They're covered as part of your student health fee that that's attached to your tuition. And our services are also confidential. So they're like with our KOKUA program, your record with us is not connected to your academic record at all.
Perfect. Kristen, can you review again? I'm guessing there are some costs and there's other costs that are not. I think health promotions is more no cost typically, but health services has some costs. So can you briefly review that again for our participants?
Absolutely. So as you mentioned, anything that is educationally based or comes out of health promotion, so the basics, counseling, screening, referral, or being part of Malama, or we do a ton of classroom outreach. Zoom has actually been kind of our friend, because we've still been able to go into all different academic classrooms and do presentations on sexual health or stress management. So those of you who are listening, you may see us at some point this semester in one of your classes. All of that is free. When you go into health services, the medical clinic, with insurance in particular, very often you might have, either just a minimal copay or in some, depending on the type of preventative service, sometimes almost no cost with insurance. Then there are some students who don't have any insurance at all, and then they bill basically you as a non-insured student. Also try to keep that very, very low cost. Then there's a third type of person, and that might be like a Kaiser person, maybe a Kaiser, someone who's a Kaiser member may come in because they think they might have maybe a little ear infection. They're not quite sure. And instead of waiting to see somebody, 3 days from now at a Kaiser facility, which is off campus, they just want someone to look at it right away. And we get that, and we actually encourage that. So we can still bill that person with another insurance plan as a non-insured student, even though we know they have Kaiser, and it's also extremely low cost. We want people to come in for service, especially if it's something that's kind of acute, like probably shouldn't wait too long. And then one last example, and this is kind of, I think, good for students to know. Let's just say we have an individual who is doing maybe a pregnancy test. Or is doing maybe some type of screening, maybe for maybe a sexually transmitted infection, let's say. They recognize that mom and dad, they might be on a family plan, so mom and dad might see that visit, or somebody else in the family. And so they choose instead for that service, be a non-insured student. And we totally support whatever that is. It's the choice of the student, whether they want to use whatever insurance they have or not. And then we just, again, can bill at a very cost-effective, low rate as a non-insured student. Yeah, it's a great question.
Thank you, Kristen. And Rachel, a question came in for KOKUA. So a student is saying that they don't think that they need KOKUA assistance at this point, but what if they decide later on that they want to use the services? Is there anything that they should think about when making that decision?
Definitely. I mean, we do always encourage students to come in early and to just chat with us and see what types of accommodations they might be eligible. Just because you're eligible for accommodations and set everything up doesn't mean that you need to make use of it immediately. So whenever the student decides that they would like to come in and see about services, we encourage them to, but definitely encourage for them to reach out to us early.
Okay, great. And Kristen, a bunch of questions came in about the COVID-19 vaccine. So we'll take one at a time. So the first question I think that makes sense is the COVID-19 vaccine required to be a student, or if it's only if you're in person? Can you kind of clarify on that?
Okay, it's such a good question, because it has been confusing this summer. So if you're confused, you're like most everyone. And the reason, not because our university administration doesn't know what they're doing, it's because things have changed so dramatically since where we were at the end of the spring semester. So it's all of us, have had to, really pivot, in order to try to keep everybody safe and still try to transition and welcome people back as much as possible. So the reason, of course, we want everyone to get vaccinated is for the entire health of our greater community. And when I mean greater community, I just don't even mean Oahu, I mean state, I mean country and planet. Because from a health perspective, the sooner we get more people vaccinated, the less likely we are to have another variant that might come around and slow down this process of reopening and reconnecting with all the people we care about. So super important vaccination. That's my, my one message. But going back specifically, if an individual lives in the residence halls, they are going to have to get vaccinated, or if they are not, because of a medical exemption or a religious exemption, they are not able to get vaccinated, they will be doing at least weekly testing, if not more. President Lasner also in his more recent messaging said that any student would have to have testing if they're non-vaccinated. And the specifics of that have not come out yet. But I think it's important to recognize if you are currently this semester, if you're a Manoa student, but you, let's say, are in California or you're in Taiwan and you're going to be a Manoa student, but not ever physically on campus, you're not in state, you're not in country, then no, it's not going to be required. But I think we also recognize, here on this call, that as we follow the trends, it won't be too long before this is no longer EU emergency use, that the vaccine is fully approved. And when that does happen, then moving down the pike, probably you will have to show that you're vaccinated in order to be on campus in future semesters. That's why I mentioned you might as well upload it now if you got it, because then you don't have to worry about it and you're set. And the other thing that I do think is probably reality is, let's just say you're all online, but you wanted to come on campus and go see a volleyball game or something later on in this semester. It may be reality that you won't be able to get into the game until you show your vaccine card. That's very possible. So I give you all that information, of course, recognizing that it's still ultimately the individual's choice, but again, we don't live in a bubble. So anything that we can all do to support each other and keep all of us healthy and safe is just, where we're trying to go.
Great, thank you, Kristen. And there's a question in here about somebody moving onto campus, so they're going to be living in the residence halls. And there was information out of Student Housing Services that instructed people to load their vaccine card into the health services portal. Is that still correct?
That is correct. Yeah.
So you're required to do that. And then they also know that they upload it into the portal and then it has to get approved. So it's not just you upload it, it has to be confirmed. How long will that take, do you think, for health services to do that?
Okay, and thank you for whoever asked that question, because that goes back to the point that I was making a little bit earlier. It's wild right now at health services because it's hundreds and hundreds of people kind of almost all at the same time submitting their information. And that's partially because of the COVID vaccine cards, but it's also because it's like 2 years of freshmen coming in, because last year, most sophomores didn't have to submit any health clearance stuff because they weren't on campus. So it's kind of a nutty time, but two things, keep checking your email, because that will show if all your information has been cleared, meaning you've uploaded your card and maybe uploaded your TB clearance, what all the other kind of requirements, but also maybe just for your own peace of mind, because I know this is stressful for students. If you have that timestamp, like if you've uploaded your card into our online portal system and you get that timestamp, it shows that, I submitted it on, let's say, the 4th of August at noon, yesterday at noon, and I see I have a timestamp, I know I'm good, if that makes any sense. It may still take a few days for health services to send you that email, but rest assured, you have got a timestamp. It's in a secure portal. You should be okay.
Great. And Kristen, there's an interesting question about the documentation for the COVID vaccine. So potentially if they've misplaced their card or they've lost it, can they instead upload their immunization record that includes the COVID vaccine on the record? Is that an okay documentation for them to use?
Yeah, that's a good question. So maybe went through their private physician,
or maybe they just lost their card. I know that I have a vaccination record with the COVID-19, so maybe that's it too.
Okay, so the easiest answer to that question is yes. Submit what you have, definitely. We have many people, so if someone's lost their card, they are not alone. Believe me, it's easy to lose a card. There's many people who've been going, if they've gotten vaccinated here in the state, they've been going to the Department of Health, and Department of Health will send you a duplicate. It's not a card, but it's like a paper. So you are not, all is not lost if you lost your card. You will get some type of duplicate. But in the meantime, I would submit what you have. And if for some reason that isn't sufficient, you'll be told that, but my guess is it's probably going to be okay. They might ask you then to follow up with Department of Health. Some people have been concerned as a sidebar. Some of us have like lot numbers of when the lot number, like if you do have to do safe travels, like it might be a number 2378 and then it says second time 2372, whatever. Some people have been worried because they're like, oh my gosh, I can't read one of my lot numbers. It's been inked out or someone put a sticker on it. Don't worry about that either. We're basically looking for an official document with dates. So if we can't read that part of it, that's more, to be honest with you, that's more tracking at a federal level than it is at a university level.
Thank you so much, Kristen. I want to be aware of time as well, and our panelists' time. So thank you so much, Kristen. I know those are pending questions that our incoming students are concerned about. So
sure.
Thank you so much. And thank you to our two other presenters, Dr. Kaduma and Dr. Kinahan from KOKUA and CSDC. We really appreciate your time today.
So thank you so much for joining us today for this presentation. We hope that you gained some helpful information from Dr. Kinahan, Dr. Kaduma, and Dr. Shawley. If you have any further questions or any questions that were not discussed, please email your OL or orientation leader or nrwo@hawaii.edu for assistance. As mentioned, this webinar will be published on the NSO platform, so please visit that page for the recording as well as links or documents mentioned by today's guests. Mahalo.